my name's Jessica. I'm a student nurse here at JCU. I understand you're coming in with some chest pain at all. Do you mind if I do a bit of an assessment on you just to figure out what's going on?
No worries.
No worries at all. Alright, so we're going to start off with a bit of an interview. So can you tell me what brings on the pain that you're experiencing?
Now that I think about it, it's when I play golf or when I exercise at the gym.
Okay, lovely. And can you kind of describe the pain? How bad is it? Maybe on a scale of 1 to 10?
I would probably rate it about a 6.
Lovely. And what kind of pain is it? Like a squeezing pain or a sharp pain?
It's about about the squeezing chest pain.
The squeezing chest pain. Lovely. Whereabouts in your chest? Is it all over your chest or is it kind of combined to the central area?
Yeah, it's that central area.
That central area. Lovely. So talk to me a little bit about the duration. Is it kind of a sudden onset or is it constant pain or does it come and go, and how long does it normally last each time?
Yeah, it definitely comes and goes, and when it lasts it's probably about 20 minutes.
20 minutes. Alright, so leading on from that, is there anything that makes that particular pain any worse? Have you noticed anything that makes it a little worse than normal?
Sitting down. No. Oh, that's right. When I push myself too hard.
When you push yourself too hard.
Especially when I'm exercising.
Oh, okay. Lovely. So that would mean that the sitting down would be what relieves it then?
Yes.
Lovely. So how is it affecting your daily life? Is it interrupting your sleep? Is it interrupting how much you exercise? Any concerns in that area?
Well, I can't finish a golf game and I'm trying to lose weight, but because of the pain it just makes it hard.
Right, okay. And do you smoke?
Yeah, but when I found out that my father had lung cancer and unfortunately passed away 8 years ago, I sort of pulled myself together and stopped. Got a young family, you know.
Lovely. Alright, so let's talk about your family history. Start with your dad. Is there any medical concerns on his side of the family?
Well, other than the lung cancer, he was diagnosed with, he had diabetes type 2.
Type 2. Lovely. What about your mother?
Well, she was adopted, but from what we can gather, she did have high blood pressure.
High blood pressure. Alright. Lovely. So let's talk about you then. Have you ever been diagnosed with a heart condition, any diabetes, or have you had any heart procedures at all?
No.
No? Alright, lovely. So let's go over what we've discussed here. So basically you're saying that the pain is brought on by exercising, so you're going to the golf, exercising at the gym and pushing yourself that extra bit harder makes the pain worse.
Yep.
But when you sit down and relax for a little while, about 20 minutes, normally it'll go away.
Yeah.
Alright, lovely. And it's a squeezing pain in your chest.
Yeah, in the central area.
Lovely. Alright, no worries. Now let's move on. I'll have a listen to your chest. And we'll go from there. So I will get you to lie down flat on your back, and we'll get this curtain closed and we'll go from there. Alright, so we're going to move on to the actual physical assessment. So what I'm going to do is I'm going to get you to lie down flat on your back. It's called a supine position. So I'll just get you to lie down, get comfortable. This one won't take too long.
Okay.
First. So can I just get you to twist your neck over to a comfortable position? So what I'm looking for is just to make sure that your vein in your neck isn't pulsating out, so there's no obvious signs of stress there. Lovely. I'll get you to face forward again. Perfect. I'm just going to have a feel of your pulse here. So what I'm looking for here is just to make sure you've got a nice strong pulse and the upstroke of your pulse is nice and smooth, so it's not jagged or anything like that. I'll just check the other side as well. Okay, lovely. So just give me kind of a quick look at your hands. I'm just looking for circulation and just make sure you're not holding any fluid in any of your extremities. So do a quick capillary test. Lovely. And have a quick look at your feet and ankles. So yeah, you don't have any swelling there or anything like that. Awesome. Alright, so I'll just get you to sit back up and we'll have a listen. So I'm just going to check your chest. What I'm looking for, just to make sure that there's no movements around your chest or any palpitations or anything like that, or obvious signs of distress. Alright, so I'm just going to have a look for the point of maximal import. So it's going right down the middle and it's around your 5th intercostal space. Okay, that's good. Alrighty, so we're going to have a little listen. So what we're going to do, so I'm going to start with your aortic valve, so that's about here in your 2nd intercostal space. So what I'm looking for is we don't want to make sure there's no murmurs, no clicks or any extra sounds. And we're going to move over to your pulmonic valve, down to your tricuspid valve, and then over to your sorry about that, it's a bit ticklish, isn't it?
Yeah.
To your vesical valve. Lovely. So we're going to do it again. We're just going to have a look. We're going to use this part. So this part of the stethoscope actually heals the lower sounds.
Oh, cool.
So we're going to have to do that again.
So handy little device.
Yeah. So the other one's for the higher pitched sounds. And while I've got this side, actually, I'm going to listen to that side of your neck. So again, looking for those lower kind of sounds. Yeah. So what I was doing there, I was just looking for, that lub. It's a kind of a lub-dub sound that your heart makes. So it's when your S1 and S2 go. So it's just that sound of your heart contracting, and it has normal sounds and abnormal sounds. So the clicks. Your murmurs and that are all abnormal. So that sounds pretty alright at the moment. So are you okay? Is there any questions you have for me?
No, I'm okay at this stage.
All okay? Alright, no worries. So I'm going to go pass you over to the next nurse, and we'll see you soon. This is Lenny Jones, a 42-year-old male presenting to the ED today with on and off severe chest pain. He's had a dose of sublingual glycerol trinitrate and 300 grams of aspirin, which has relieved the pain. I performed a cardiac assessment and determined that the pain is centralized squeezing to his chest, which is aggravated by physical exercise, namely golfing and a gym session. Vital signs show high blood pressure of 165 over 105, high heart rate of 101, and he has tachynemia. Room air saturation, at 95%. I noticed during the assessment his pulse was strong and thready. There was a slight ankle swelling and the capillary refill was slightly slow. He has a family history of type 2 diabetes, high blood pressure, and he stopped smoking 8 years ago. The pain has been on and off for the last 2 days. Based on his symptoms, I'm thinking stable angina. With the type of pain, the duration, his vital signs, it being relieved by nitrates, and the fast onset from physical exercise. Fairly early stages, there's no signs of cyanosis, but slight clubbing in the nail beds. I would recommend the doctor ordering an ECG and a chest X-ray to make the diagnosis. We also need to get his saturations up, so firstly some coughing and breathing exercises, and if that doesn't work, he may need some oxygen.